Obtaining patients' health history through interview is a process of collecting subjective data that provides a detailed profile of the patient's health status. Therapeutic communication skills and interviewing techniques are used during the health history taking to establish an effective nurse-patient relationship and to gather and identify actual and potential health problems as well as sources of strength.
Interviewing principles. 1. The first step in caring for a patient and soliciting active cooperation is to gather a careful and complete history. 2. Time spent early in the nurse-patient relationship gathering detailed information about what the patient knows, thinks, and feels about the problem prevents time-consuming errors and misunderstandings later. 3. Skills in interviewing affects both the accuracy of information elicited and the quality of the relationship established with the patient. 4. The interview encourages exchange of information between the patient and the nurse. 5. The patient must feel that his or her words are understood and that his concerns are being heard and dealt with sensitively.
Purposes to identify risk factors for alterations in health that relate specifically to the body system being assessed. Number 2, to gather subjective data and combine these with the objective data from the physical examination and laboratory studies to form the database. Number 3, to provide a complete picture of the person's past and present health. Number 4, to assess the client's lifestyle, including such factors as exercise, healthy diets, substance use, risk reduction, and health promotion behaviors. Number 5, to gain detailed and chronologic record of the patient's health problem or problems. 6, to establish rapport with the patient and the family members during the interview.
Preparation. Number 1, plan the interview and setting. Before the beginning of an interview, the nurse reviews available information, surgical procedure report, information about the current illness, or literature about the client's health problem. Review the agency's data collection form to identify which data must be collected and which data are within the nurse's discretion to collect based on the specific client. Number 2, time. Plan the interview with clients when the client is physically comfortable and free of pain and when interruptions by friends, family, and other health professionals are minimal. Number 3, place. Conduct the interview in a well-lighted, well-ventilated room that is relatively free of noise, movements, distractions, and where others cannot overhear or see the client to provide privacy. Number 4, sitting arrangement. Plan a sitting arrangement such as allowing the patient and the interviewer sitting on 2 chairs placed at right angles to a desk or table or a few feet apart, creating a less formal atmosphere that will allow both parties to feel on equal terms. Number 5, consider and remain sensitive to the patient's psychological and physiological needs. Number 6, hand hygiene and use of PPE. Hand hygiene must be performed prior to meeting the client along with the intentional wearing of personal protective equipment as needed to prevent spread of infection and to protect oneself from being exposed to communicable diseases.
Cultural considerations. Personal space. 1. Anxiety increases the need for space. 2. Physical contact is used only if it has a therapeutic purpose. Touch, even a simple hand on the shoulder, can be misinterpreted especially between persons of opposite gender. 3. Known risk factors for alteration in health that are based on racial inheritance and ethnic backgrounds, as well as normal variation that occur within races. Use of therapeutic nonverbal and verbal communication techniques. 1. Nonverbal communication techniques. Nurse's appearance, nurse's demeanor, facial expression, attitude, silence, and active listening. 2. Verbal communication techniques. Open-ended questions, closed-ended questions, laundry list, rephrasing, well-placed phrases, inferring and providing information.
The first phase of the interview is the pre-introductory phase, wherein the attending nurse reviews the medical records if available before meeting with the client.
Reviewing the medical record may assist the nurse by knowing some of the client's biographical information that is already documented. If the client has been in the computer system for some time, it may reveal various medical history and recent information.
If available, obtain information regarding patient's ability to understand the nurse's dialect, language, or severe hearing impairment. Arrange for a translation service or interpreter during the nursing interview. Determine the patient's ability to speak and understand. The patient may be a deaf-mute. Translation services are preferable to using family members to ensure correct translation of medical terminology. Gathering this data will allow the nurse to seek assistance from a deaf-mute interpreter and help from a family member or caregiver to ensure hearing aids will be available for the patient to use.
Introductory phase. Number 3. Greet cordially and introduce yourself to the client, significant other, family members, and caregiver, and shake hands if appropriate. Courteous greeting and introducing oneself to the client and others in the room express warmth and respect and helps establish rapport.
Explain your roles and responsibilities for the interview.
Providing personalized care reduces anxiety about the interview and clarifies staff roles.
Number 5, identify your client by asking his or her name, date of birth, and verifying the client's information in the name band. Address client by using Sir, Ma'am, Mr., Mrs., and Miss, and the client's last name. Thorough and accurate identification of your client eliminates misunderstanding, improves patient safety, and prevention of medical errors. Addressing the patient cordially helps establish rapport.
Number 6. Explain the purpose of the interview. Discuss the types of questions that will be asked, explain the reason for taking notes, and assure the client that confidential information will remain confidential. Some agencies may require a consent from signed by the patient before the interview proceeds. This step conveys concern to the patient and assists in developing trust and rapport. This projects a sense of priority and interest in the client. Obtaining a signed consent involves informing the client about his or her rights and the purpose of the interview and the procedure to be undergone.
Ask the client if it is all right to allow the spouse, family, friend, and caregiver to remain or leave the room during the interview.
The client may wish to be left alone with the nurse during the interview to promote privacy of information. The client may need a spouse, family member, and caregiver who are knowledgeable about his or her health status and history to be present during the interview to give adequate information. Patients that are unable to answer questions due to alteration in mental state, physiological barriers such as unaided hearing loss, confusion, developmental alteration may require their designated caregiver to answer the question.
Working phase. 8. Gather essential information from the patient or caregiver by following an organized sequence of questions about major A. Biographic data, name, address, phone number, gender, provider of history, birth date, place of birth, race or ethnic background, primary and secondary languages, spoken and read, marital status, religious or spiritual practices, educational level, occupation, and other significant or support persons. These pertinent data are needed in the synthesis of the treatment plan, diagnosis, and follow-up after the treatment.
B. Reasons for seeking care of chief complaints. The chief complaint is the issue or issues that the patient is presenting with and the primary reason for the visit. This is typically documented in the patient's own words and is therefore quoted in the written or oral presentation.
Obtain patient's history of present illness or history of present concern using the cold span mnemonic known as character, onset, location, duration, severity, pattern, and associated factors.
This is to ascertain a complete, accurate, and chronological account of the illness from the patient. These 7 attributes need to be addressed to obtain a well-characterized description of the complaint.
Past health history, which includes allergies, problems at birth, and childhood illnesses. A thorough collection of this information establishes baseline data of patient's health history that may have contributed to the present illness. A comprehensive health history provides a holistic view of patient's health problems and responds to those problems.
E. Family history. To obtain an overview of the patient's family health, including that of grandparents, parents, brothers, sisters, aunts, and uncles. This will also determine familial tendency of hereditary illness.
Review of body systems for current health problems.
To obtain detailed information about the current state of the patient and any past symptoms or lack of symptoms patient may have experienced related to a particular system. This may give clues to diagnosis of multi-system disorders or progression of a disorder to other areas.
G. Lifestyle and health practices.
Summary and closing phase. 9. Summarize information obtained during the working phase and validate problems and goals with the client. Identify and discuss possible plans with the client to resolve the problem by formulating priority nursing diagnosis with the client. Summarizing this information facilitates distilling, synthesizing, and prioritizing critical information for the purpose of planning and facilitating a wide range of clinical tasks.
Ask the client if he or she has any question or if he or she has more concerns. Ask, is there anything else you would like to tell me?
This allows the client to end the history by saying what is on her mind and what concerns him or her most.
Let the client know that the physical examination will follow next and follow-up appointment may be necessary. Terminate the interview by thanking the client, caregiver, informant, and interpreter for the information you have gathered. The client will be able to feel a sense of acknowledgement as an active participant in the treatment plan. This step will also give the client a sense of recognition and respect to self and toward the healthcare team.
Hi, good morning, ma'am.
Hello, nurse. I would like to have my health check. I think there's something wrong with me.
Okay, I'll just get your biographic data first. So sit down. What's your name now?
My name is Angel.
Angel. Where do you live po?
I live in Cagayan City,
Are you with a relative or are you alone?
I'm alone.
How old are you, ma'am?
I'm 39 years old.
So when's your birthday?
October 2.
November 2. Email. Okay, ma'am. So, gawas na ng set na kayo. Kuha sa inyong height and waist. Hi, Nurse Aldrin. Your next interview is Miss Angel Labajo. She is 39 years old, a female. Naanadalitan na ang iyang data. So, ikaw na yung
Okay, thank you.
Thank you.
Morning, ma'am. I am Alvin Amaliana. I will be your nurse for today. So, as recorded, your name is Miss Angel Labajo, correct, ma'am? And your age 39. Okay, so how do you want me to address you, ma'am? Miss Angel lang or someone? Okay. So, Miss Angel, I will be conducting an interview para makabalita kung may problems regarding your health. I will be taking down notes, ma'am. Pero please do know na these notes or this information that you will be giving me and how we take notes kay this will be highly confidential. Is that fine with you, ma'am? Okay, so you're Miss Angel Labajo and your age 39. So ma'am, before to mag-start, do you know what day today is? Yes, nurse. It is February 13, Manila. Okay, so ma'am, as stated here sa record kay nalipong ka ma'am and you have difficulty of breathing and also you're suffering from fatigue. By any chance, ma'am, are you feeling any pain right now or previously, like the moment na na-feeling mo? Yung ating nurse kayo, masakit yun ako nito yung okay, kinapit sa heart. Would you, can you describe kung siya, what's the characteristics na niyang thinking? Or parang nilaganan or what? Is it?
Dili po siya mura dito sa puso. Ano siya di, ano may kadali ko, bukat na siya.
Pero sa kanya siya nag-start, ma'am, okay.
Ay, nurse, nabili 3 months ago lang yun. Niya, ayaw ko niyang hindi na kaya pa na po.
So, nag-faint ka niya. Hindi niya earlier or kansa?
Kanya po tag mga alas 10, kadulong 11. Yeah.
So, this pain that you're feeling, ma'am, where is it located? Sa chest na ba dun siya?
Chest area.
Or direct siya towards your arms or towards nasa? This pain that you're feeling, na ba siya can you tell me kung saan siya kadugay the last?
Ano siya, hindi siya ako sobrang uwi sa kami nito, pero kung pamatiyon dyan na ako, mabot na dinamig sa kami nito, pero tumunod siya, hindi siya mulapas, anak.
So, ma'am, on a scale of 1 to 10, how would you rate this pain? 1 being the lowest and 10 being the maximum na pain na mafeel?
Ako pamati, kay mga 7.8 siya, kay kuan ka na, pag nakabuhaton niya, ito ka lang kasakit, muling ko, jud ko, pamatiyon, gitna ko nga, kasakit, git siya, kaya dili ko kabuhat og laing butang, kung kuan, buko ka nakasakit.
So, whenever masakit siya, ma'am, muling ko, jud ka to lessen the pain.
Dili po sa pag-lesson sa pain nurse, kuan siya, dili siya mo-lesson niya, malingkod lang po kayo, hindi na ko dapat malingkod po.
So, are there any activities or things na yung mabuhaton para ma-lessen ang pain or if napakayo buhaton while nagkasakit siya, ay ma-worsen siya?
Asa itong malingkod ko, ang mabuhaton kayo, hinga ko lalo, niya, ma-lesson siya gamay, pero naragapon siya sa 7, gapon next, or gid siya, hinga na gid ko lalo, pag-ampo gid ko nurse, naambot lang yun, tugat lang yun ko Lord, maundang ang tani, niya, di ko siya maundang, hindi na napod, doon sa mukala, rin siya, hindi na gaan-gaan na sila.
So, while na-feel niyo ang pain sa inyong chest, ma'am, na ba yung associated factors or may mga other symptoms na yung mabatian with it, along with it?
Kung nabantayan, so dato nga ako yung mga kanang masakit diri sa akong kasing-kasing, Dali na ako kapuyon. Dali ko sa balay, dali na ako kapuyon. Kasi naayos ay, magsakit ko na akong ulo. Lang anong kasakit ko na akong ulo ko. Kaya tingali sa kanang bato, ang naon.
So, oral din nga ba ng fatigue and dali ka kapulan, ma'am. So, ma'am, let's go on to your past health history. During or at birth, ma'am, na-diagnose ba ka with like heart failure or problems sa heart or sa lungs, heart defects?
Wala ko na
Okay, next is, growing up as a child, have you suffered childhood diseases like chickenpox, pneumonia?
Chickenpox o malupo ka na.
German measles, ma'am, have you had? Wala. Have you had head lice?
Bagal na itong bata ko.
So next, ma'am, let's go to your immunizations na receive when you were a child. So, makadungdong ba ka, ma'am, if wala kay health record or immunization record, makadungdong ka sa mga vaccines or immunization na nahatag sa inyo, ma'am?
Basta yung mga kumpleto.
Okay? Okay. So, let's go on to your adult illnesses, ma'am. Karoon na medyo, idara na ta. Are you suffering from illnesses, be it physical, mental, or emotional? Ito kay allergies, arthritis. Do you feel or were you diagnosed with clinical depression? Are there any pain in your body? Generalized pa or sakit mo wrist, sakit mo hawak, sakit mo knees?
Wala ko din mo, bigyan ako na rin mabikin ko.
So, you're suffering from headaches or migraine?
Headaches lang, hindi siya migraine. Bali, doon siya sa pagkalipong. Mga na.
So, since now you're married, as we can hear in this record, so are you sexually active? Yes. So, this is a sensitive question, so I asked you not to be offended by this, but do you have STIs, ma'am, or? So, ma'am, have you had any surgeries before?
Katulong grade 8 pa ko ato, extra kambing na ito nga sa akong neck, and then wala na tayo yung
So, when was that? Kaya saan siya surgery nga?
April 2014 at miss.
So, have you had any accidents before?
Vehicular, but hindi siya require ang mga hospitalizations of any kind. Wala may injury, pero na-accident.
So, kaya saan siya dito ba?
Ito pag sa mga panahon na high school ako ako na yun ang kahit kung hindi ako kanundong yun.
Ito the year, ma'am?
No. Okay, too many to mention on some
Okay, so since you said okay, allergies, do you have any medication yung ginagawa ka?
Wala any. Ano, may daming sa'yo.
Okay, so sa family history, do you have histories of mga diseases?
Sa side sa akong papang is, kuan siya, dagan kayo, high blood. Ako kabalakan, di ba sa hypertension, ako bulungay na high blood. Kuan man, di ako kusog ang tuko. Kung di lagi, pasapasa sa mo ang yun.
Okay, so what else, ma'am? Is that all? High blood pressure from your father's side?
Sa akong father's side ko, mababay kasi kala may breast cancer, pero I don't feel anything about regular. Sa akong body.
Okay, so high blood pressure and breast cancer, ma'am. No asthma?
Wala ko.
Diabetes? Wala. Okay, so on to the review of systems. I will just be asking you questions regarding katong naman na ay problems mga inuti state, like for example, on head and
Kapag ka nasa lawas is
yes, okay, so consider na sa head and neck since ingon mo ka nga sakit imong ulo or ba ito nga palay sakit sa neck or anywhere. Okay? Then, since you said na you're suffering from difficulty of breathing, if mag-breathe ba ka ma'am, are there any wheezing sounds din mga okay? So, do you feel shortness of breath during regular activities?
tukar akong chest pain, doon na niya. Ano siya? Okay nga tao.
So, sa heart and neck vessels, do you feel any palpitations? Okay, so only the chest pain and the pressure can feel. Okay. So, go into during sa reducing on lifestyle and health practices na. So first, can you tell me what your typical day is? Sige mo buhaton right from the moment you wake up and before you sleep.
Pag matang ako, hanggang kung mabigang ko sa balay, magluto, pagkakot ako ng bana, mga anak, paligo, makaon sila, pagabot, pag malakaw na sila, kung may nagpanakaw, malimpyo na sa balay, mga palimpyo, ipawalay ko pa tapos magpaan ko dahil magpanito na ako. Naman na panito na ako, ang gardening mahuto after anak, hugas magplato, nabay yung iunon, nabay nakaunon, mga diha, mga 1 to 3, ito wala ka sa hapon. Pamanan na, kung wala bigay buhaton dyan, mag-gardening na ako, sa ko mga kuan. Ang ako kong garden, kaya pinapin ako landscape bitaw, ako mismo ang gagawa ng is, kanya, kuan, pag kahapon na, mga alas 4 kapin, mga alas 5 na, magluto na ko tayo bukat, hapon para sa ibang pamilya, sa gabiing, ako pang asawa, mga tumi, ako tulong limpyo, tabangan ko sa mga anak na mo, oto, nya, limpyo. Pag man nila, kung masa sila tanan, kung i-assign nyo, pag wala na-assign nyo, kung matabangan, buhaton, tulog tayo, or kung napay ang istoryahan, kaluhan, yan ang mga buhaton. Tulog ko mga 9 to 10 p.m. dyan.
So, since ikaw ka nag-prepare sa inyong food, what do you usually prepare sa mga klase sa food?
Combination siya meron sa sahay, kung suhan may, seafood may, pero yung seafood yun siya, wala laing gulay. Kung regular nights lang, mga adobo, or mix sa meat or vegetables.
So, since ikaw na nag-prepare sa inyong home cooked ng mga meals, how often mo ka eat out sa mga restaurants or
Ay, alam kong manimbang kung ang panimbang ako, yun yung pandan, kami sa gawas, or may anniversary, or kailangan i-celebrate, ito dito sa gawas. Pero, tas, for me, dyan, malalig ka ako.
So, aside sa gardening mo ma'am, ano sa ba yung lain na daily activities or exercise ba?
Kung imbitaw ko sa mga karing, magsumbabi, kung dili po, okay na po sa ako lang mga kuan, yung plus balay, kung sa ako. Magchat-chat lang ng millionaires.
So, you sleep around 9 to 10 p.m. and ma'am, no? Is this constant siya ma'am? Or na ay mga exemptions?
Sa ako, okay. 9 to 10 na yun. Or na-usahay mga, dukitan na, okay. Ay, nabugay kayo mga sabaw kami sa mga high school, mga anak, niya usahay kayo, maglungon, di kayo na sila maglungon, di kayo, niya, storyahan sa anak po, tawungon din ako nga, na ay malagaw sa aming pangyaw-yaw, ay matulog, ako ta mga 11, na mga, hindi lagi 9 to 11, 9 to 10, yung anak.
Regarding your complaints ma'am, no, kay, associated with it, naa ba kay troubles with sleeping or problems with sleeping or disturbances during sleeping?
Ay, walang hindi ko madungog, pero akong bana, nareklamo sa kuda, 3 months ako po, hindi ko lang bana na, muna na ako, katingog na akong murog, gahapon, doon na sa ako, akong pag ginawa sa katulog, kay, kasi dali na siya magkapod, kay, hindi man na siya madunggan, ako niya na-araw yun siya, lalahig, pilit, abnormal na siya.
Okay, so since 9 man ka mag-sleep ma'am, then early ka arise, can you prepare for your family? How much sleep or how many hours ang matutulog ma'am?
Mga 7 to 6 naman yun, 7 to 6, ay, I think minutes.
Okay, so when you wake up every morning, kay feel ba mo rested ka or kapoy, nagyapon ka even though you had your 7 hours sleep?
Ay, mga buntag ng kapoy, di kayo na, wag lang yun, di ko nang liho. Nakapil ba, na mga adlaw ko mga kuan. Mas kami tingnan mo ng mga adlaw ng makakaulay, dito ko, mga rested dito ko. Nakapil ba na, di na lang ito malihok yun, magulat na lang ito nga, mga anak ang lihok kasi sila, ay may kapoy, di kayo sila dito.
So next ma'am is, what do you do to help you fall asleep? Or if na ba?
Kuan lang, hygiene lang, kung madayon,
Okay, since you're a housewife, how do you take appetite naps or yes? Okay, so ma'am, do you drink wine or beer or any alcoholic beverages? Even occasionally ma'am?
Occasionally, usahay na dyan na, occasionally kay nurse na, ay na dyan kung mapugos dito kayo. Marunong din ko nito, kaya ko may nom.
Okay, so aside from that, do you drink coffee or caffeinated na mga drinks?
Tira ko mix niya, ano siya, kasi laging caffeinated dito ako mati.
Okay, do you do recreational drugs or smoke? Okay. Do you take vitamins or herbal supplements na?
Vitamins lang, herbal C. Ngayon, sa skip ko dito, bigyan na siya every day.
Okay. So, how do you feel about yourself now? Kung sa imong ma-feel sa imong self?
Mabati ko magnanap ako sa points ako ginabuhi, mabati na ginagawa mga sakit dyan sa kuan. Kung baka ha, sa pamilya, gito nilikan, naging sa dugo, nilikan mga air, nalikan ko rin ako, dali na ako paguyod, na subi na pangakit ko ako sakit.
Do you think, ma'am, na kana ay mga batian na marag simply na ka, is that because of your age or something?
Mabati na ako kayo, partly tungkol sa akong age, magawas na ginawa mga symptoms na, dali na ako yun, ngayon na, pero partly po sa family history dyan ako, nurse kayo, kusog dyan kayo ng dugo, mga kasakasa, ginawa mga high blood pressure, may nanak ang sakit.
So, since you are married and you have children, ma'am, I'm sorry if you find this quite offensive, but do you still engage in active sexual?
Yes, regular minutes.
Ma'am, do you have any family planning na mga ginagawa? For example, taking up contraceptives?
Ay, kapag yung pag-deal sa next.
So, ma'am, regarding your health, how often do you have your medical checkups or screenings with your physicians?
Hindi kayo regular minutes. Mga 1 year ago, patutulas na kung yung antukuan, para makacheck up.
Do you have your eye doctor, ma'am, or
Wala ko yung specific kung sa may mga sa mga bilabang clinic or na recommend sa mga amiga.
So, ano yung ginabuhat, ma'am, for fun or recreation? You have your family day, like Sunday, or
Maka na, kailangan mo ng mga bata na mo bilaw badminton, mga volleyball, bana na mo, or saya kasi na ko yung sa zumba, or manipbami, naglaag, nakalakaw, hindi alam sa mga dulo.
So, since housewife mo naman, busy kasi yung household, do you think na enough na gihapon mo time to socialize with other people?
Kana, wala kay ko, wala na kay, sa akin mga good, ako mga amiga po, nalabaw ko pamilyado, busy po sila, masabtan na lang ako nga, kasi hindi kami magkita, o kung makalibre mo ka na, go me, sige,
So, ma'am, how is your relationship with your husband and your children? Are they good? Or,
sa kung makabatlong, ay really good, pero kung paano ang relationship ko kay but strong yun, hindi na ako sa gabang simpa, hindi na ako sa gabang grocery, akong bana, active man may, so okay rin kayo.
so right now, ma'am, as the moment, what is the most important to you in life?
Importante ka bang makuha ng mga anak ko sa eskwela, makabot na sila college, basta ang pamilya, ako mag-iwan na, hindi kayo na ng basta. Kung may problema nga, kung tama, makagawas niya, kami kuso para makakuha na ng bawang. Parang mata, ako ang tapang nurse kayo. Ako ang tapang buhay retention ba kumuhay ni, or kung makagili sa akong family history, yung tama ka ba, may ako, gusto mo, kumitagot lang ng sila, makaya kung pinangan bagot sa akong pinabuhi.
So, ma'am, what gives you the strength or what gives you hope na ma-okay ka?
Ako kayo pagsalit sa Ginoo yun. Okay na. Opo na akong gusto ipasa sa akong mga anak. Ano nga, na sila sa ilang stage na panungon ng ayo. Gusto yun ako nga. Dako yung pagsalit sa Ginoo. Kapalo dito mga pamang sa mga ano. Pagsulay. Basta, salit lang po.
So, ma'am, since wala ko ka ng work, are you contented or satisfied with what you have achieved academically?
Nakagraduate mo akong guest nursing. Yeah. For ana, nagtitin ako ba na munto, mga anak mga 9 ko, wala nakapunta sa trabaho. Sundan tayo. Sabi ako na sila. Karoon nga, gawin na online ako. Pero kadulungay pa siya mas stable miss. Starting naman po. All ko kung ilinin mo pa ng sakit. Malayo.
So, kinsa may nag-provide really, kanang mainly provide or support financially sa inyong family na?
Ay, akong ba na dyan, please. Sa akin, akong bebek ng gusto ka namin may family business. Pero igo ako makatagan sa mga ano yan. Sa bukid.
So, ma'am, ano may makapalapot sa inyo or makapastress inyo?
Kamay lang yung owners, ba na akong mga anak lang yun, makabadlong sila. Ba na akong namin financial problems. Mga na nasa balay, ako akong pamilya. Pamilya, ikaw yun.
So, ma'am, ano may magkabuhaton para mawala yung stress or yung kalapot, ma'am?
Ayaw mo, nauna akong mga butang-butang. Ano yung tabok ni, say, mali, kasi pwede masolusyon. Ikaw ba naman sa akong dili, ikaw na lang yung taming anak. Nagko na butang, huwag na.
So, ano may makita niyo mga greatest nga stressor niyo as of the moment?
Nurse, hindi ako nabati kong hindi yun. Kung napacheck up lang ko at 3 months ago, hindi ka sa mga ingani. Wala pa mga buko rin. Ako, nakalala, gid siya mo. Kasi kasi kung ginawa na, kasi reflect ako ng story, ang family story ba?
So, ma'am, kay kinsa man ka ba ask for help in times of crisis or if na kay problem, kinsa na yung masultian?
Akong ba na, George, yung anak ang suod, o mga papa, yan sa mga pamilya, lagi kaya, ako lang.
Yeah. So, ano may risks na aware ka na sa inyong community?
Yung mga safety, anak, ay wala akong po, yung anak ay subdivision, ang iba ko yun.
So, after naman na tayo physical examination, that would include ka ng examination of your body parts or review of your system. Is that fine with you, ma'am? Wala may bawal sa inyong division?
Okay.
Sige, ma'am. That's all. Thank you, ma'am, for participating. Salamat.